Welcome viewers to an in-depth look at snowflake cataracts, a unique form of cataract often linked to diabetes. We'll explore the causes, symptoms, and treatments for this eye condition, helping you understand how it impacts vision and what can be done to manage it. Snowflake cataracts, as the name suggests, are predominantly associated with diabetes, particularly in younger individuals with poorly controlled blood sugar levels. While not all diabetics develop this specific type of cataract, it is a well-recognized complication of the disease. In rare cases, they may be seen in other metabolic disorders, but diabetes remains the primary culprit. It's important to note that even temporary periods of elevated blood sugar, such as during pregnancy with gestational diabetes, can potentially contribute to their formation. Though this is less common, the pathophysiology of snowflake cataracts is rooted in the metabolic disturbances caused by elevated blood glucose. High glucose levels in the blood lead to increased glucose concentration within the lens of the eye. This excess glucose is then converted into sorbitol and other sugar alcohols by the enzyme aldose reductase. Sorbitol is poorly metabolized by the lens cells and accumulates, leading to an increase in osmotic pressure within the lens fibers. This draws water into the lens, causing swelling and disrupting the normal structure of the lens proteins. These damaged proteins clump together, resulting in the characteristic snowflake-like opacities that scatter light and impair vision. The rapid osmotic changes can also damage the lens fibers directly, further contributing to cataract formation. The exact prevalence of snowflake cataracts is difficult to pinpoint, as many cases are simply categorized under diabetic cataracts in general. However, it's generally understood that they are more commonly seen in younger individuals with type 1 diabetes, especially those who have had poorly controlled blood sugar for an extended period. Older individuals with type 2 diabetes can also develop snowflake cataracts, but they are often less distinct from other age-related or diabetic cataracts. Due to improved diabetes management, the occurrence of snowflake cataracts may be decreasing, but it remains a significant concern for those with uncontrolled blood sugar levels. The most noticeable symptom of snowflake cataracts is a gradual blurring or dimming of vision. Individuals may experience increased sensitivity to glare, especially at night. The hallmark of this type of cataract is the appearance of small, white, snowflake-like opacities within the lens. These opacities can initially be small and scattered, but they tend to grow and coalesce over time, leading to a more significant reduction in visual acuity. In some cases, the cataracts may progress rapidly, causing a noticeable change in vision over a relatively short period. Patients may also experience changes in their eyeglass prescription, and frequent adjustments may be needed to maintain clear vision. Diagnosis of snowflake cataracts is typically made during a comprehensive eye examination by an ophthalmologist or optometrist. The examination will include a visual acuity test to assess the clarity of vision, followed by a dilated eye exam. During dilation, eye drops are used to widen the pupil, allowing the doctor to view the lens more clearly. Using a slit lamp, a special microscope with a bright light, the doctor can examine the lens in detail and identify the characteristic snowflake-like opacities. Other tests, such as tonometry to measure eye pressure and a retinal exam, may be performed to rule out other eye conditions. A thorough medical history, including information about diabetes diagnosis and blood sugar control, is also essential for accurate diagnosis. While snowflake cataracts themselves are not typically classified into different stages like age-related cataracts, the severity and location of the opacities can vary. Some may be small and peripheral, causing minimal visual disturbance, while others may be larger and more centrally located, leading to significant vision impairment. The rate of progression can also vary significantly between individuals. It is important to consider that different types of cataracts can coexist in the same patient, and the management of cataracts should be tailored to the individual's need. The primary treatment for snowflake cataracts is surgical removal of the clouded lens and replacement with an artificial intraocular lens, or IO. Cataract surgery is a safe and effective procedure that typically involves phacoemulsification, where the clouded lens is broken up using ultrasound and then removed. The IO is then implanted to restore clear vision. Before surgery, careful management of blood sugar is crucial to optimize outcomes and minimize the risk of complications. Post-operative care includes using eye drops to prevent infection and inflammation, and regular follow-up appointments with the eye doctor to monitor healing and visual acuity. Prevention of snowflake cataracts primarily involves strict control of blood sugar levels in individuals with diabetes. This can be achieved through a combination of diet, exercise, and medication, as prescribed by a physician. Regular eye exams are also crucial for early detection and monitoring of any changes in the lens. Patients should adhere to their prescribed diabetes management plan, and seek guidance from healthcare professionals on how to maintain optimal blood sugar control. Maintaining a healthy lifestyle, including avoiding smoking and excessive alcohol consumption, can also contribute to overall eye health. The prognosis for individuals with snowflake cataracts after cataract surgery is generally excellent, with most patients experiencing a significant improvement in vision. However, individuals with diabetes may have a slightly higher risk of post-operative complications, such as macular edema or retinal detachment. Therefore, careful pre-operative evaluation and post-operative monitoring are essential. Recent research has focused on developing improved IOL designs and surgical techniques to further enhance visual outcomes and minimize complications. There is also ongoing research into the potential for pharmacological interventions to prevent or slow the progression of diabetic cataracts, but these are still in the early stages of development.